in the field of Ayurveda. Now, the chairperson for this session is Dr. Naveen sir, and the co-chair is Dr. Sumit sir. So, first of all, I would welcome Dr. Girish KJ to the stage. Sir, please.
Good afternoon, everyone. It's an immense pleasure for me to introduce Dr. Girish KJ, sir. Sir, as Dr. Abhijit told you, sir is the present Vice Principal and Professor in the Department of Ayurveda at Patanjali Vidyapith. Before that, sir was Professor and HOD in the Department of Ayurveda in SDM College of Ayurveda, Hassan. I know him very personally because he is my sir. And more than that, sir's Mrs. is also just immediate senior to me. So I had a lot of privilege to work under him. And I learned a lot of things, especially whatever I do in the field of IT. It is sir who has inspired me that an Ayurvedic doctor can be a technician also. I have been told to introduce sir in a brief period of time and a very short way. If I start introducing him, I will take the entire session because I know a lot of things what he has done in the field of Ayurveda. To be concise, sir has done his graduation from Mysore University and sir has done his post-graduation from Gujarat Ayurveda University, Jamnagar. Sir has also done his PhD from the same institute of Gujarat Ayurveda University. Sir has served as the research coordinator in SDM College of Ayurveda, Hassan. And sir was also been the academic dean and dean program officer in SDM College of Ayurveda in the year 2021. Sir has been awarded the Best Teacher Award in 2011 and 2021 of SDM College of Ayurveda. And sir has published many original theses in national and international journals. Sir has specialized in the field of Vajikarna, and sir's PhD topic is also in the same field. The main highlight of sir or main catch of sir is that sir has designed and developed a database for research in Ayurveda. Those who are doing PG, of course, they might have gone through it. It has almost 1,000 theses of post-graduation which has been completed in the Jamnagar University. That is considered as one of the, treasure hunt of Ayurvedic research. And that contribution of sir make him very special in the field of Ayurveda. And sir is now working on the 8th edition of Ayurvedic research database, which is in the pipeline. I congratulate him and I expect that the 8th edition is going to be better than the 7th one. And I request him to come on the dais and talk about his topic or on SUKHAAYU. Thank you, sir. Welcome.
Thank you, Sumit. Respected Principal Sir, Dr. Manjunath, all the faculty members, I know most of them, lucky to be here and being invited. I thank for the opportunity. It's nice to see all young students. And if I can have a mic, that's really great. Okay, no problem. Am I audible? Cordless. Okay. It's nice to see you all here. No doubt, you all may be very, you are all maybe first year or first year seniors. The topic that I'm going to talk, I'll not be dealing with all the. I'll not be dealing with all the topics related to excretory channel. I'll be talking to the Ayurvedic management of male infertility and male sexual problem. I thought I should cover all the topics related to excretory channel, which is very vast. सर के ऊपर चला जाएगा, लेकिन ये जो टॉपिक है मेल इनफर्टिलिटी और मेल सेक्सुअल प्रॉब्लम इज वेरी क्लोज टू अस, राइट? Sex is universal, but at the same time most personal. Hope all of you agree with me. So I'll be speaking. I have worked a lot in this field. I thought the topic, the point I want to make, I think there may be very few who would speak on this, and I believe that I can do justice to it. So I have limited myself to Ayurvedic management of male infertility and male sexual disorders. These are the contents. I'll be first dealing with male infertility and how to clinical diagnosis, including evaluation, and Ayurveda management, followed by male sexual problem. First years must be knowing the definition of Vajikarana Tantra, right? So all the first year and second years, if not, these are the two objectives. Apatya Santanakaram Sadhya Sampraharshanam. These are the two objectives of Vajikarana. Vajikarana is, you can make it as, it's andrology. Andrology. You can note down, andrology is the branch of male medicine, which deals with management of male sexual disorders as well as male infertility, maybe through medicine or through surgery. Today morning, Avdesh sir was talking about Shukrava Sroto Dusti. You may wonder to know that even penile fracture do happen with the Lakshan. Penile fracture do happen and surgical correction is possible. So andrology, especially surgical branch, with the help of microvascular surgery, has advanced a lot. Okay, so here Apatya Santanakara deals with fertility aspect. Sadhya Samprarshana, objective of Vajikarana, deals with the recreative aspect, sexual aspect. Hope it is all of you are getting it. Fertility aspect and a sexuality aspect. I should say that for last 1 century, there is a lot has been done, especially in the modern medical side, whether it is male sexual disorder or male infertility management or female sexual disorder. Obviously, gynecology everybody knows, but female sexual disorder, FSD, lot has been done. Last 20-25 years, lot work has been done, especially in the Europe and USA. In many of the universities, lot has been done. Sex is no more, to be shied at. Patients do come to you. Patients do come to you with a specific problem. They may suffer from either from infertility related or sexual. So whenever you come across patients with male infertility or any sexual problem, you should not shy away. It's a serious problem for them. Sex has been glamorized for no reason. Sex has been hyped. But remember, when it comes to couple or a person, sex is a very, very core issue. Most personal and the core issue. Okay, so let us get into the, without much. Infertility is defined as inability to beget a child even after 1 year of unprotected sexual intercourse. That's the classical definition of infertility. All of you must be knowing. Beginners should know what is the definition, technical definition. There is a branch called as gynecology, but not so andrology. You need to understand that 50% the cause may be in males. What do gynecologists would do is request for a semen analysis report, At the maximum, Doppler study of scrotum and penis to assess the size. Are there any blockage? Are there any other pathology? You need to understand that in Ayurveda, no doubt, the Vajikarna is considered as a separate branch. It existed since time immemorial. Ayurveda is Anadi. Since thousands of years, Vajikarna did exist. Vajikarna specifically deals with the management of male sexual and male infertility diseases. So, but andrology has evolved in the last 25 years. There are few specialists like Dr. Sudhakar Krishnamurthy. I know one person who is Dr. S.S. Vasan in Bengaluru who specialize. But majority of the work has taken place in America, US, European countries. They are very serious. Whatever they do it with a lot of seriousness. So the andrology has evolved. So also proper evaluation of the cause for male infertility. It shows that 50% of the instances males may be responsible. You can note down all these points. Whatever I'm telling is the result of last 20 years. No theory. It's all practice. With what all complaints, especially male infertility related, the couple can approach you. इससे परे कुछ नहीं है. आप लोग भी प्रैक्टिस में बैठेंगे ना तो यही no issue are eager to conceive, right? They are eager to have a child, but they are not able to get a child. That's one common presentation. Always, when in the clinical practice, you have to understand what is the presentation. Presentation will lead you to specific an approach, maybe diagnostic as well as the management, therapeutics. Already having one kid, willing to beget second kid, but it is not happening since many years. Already having a child, they want to have second child. It may be usually male. Couple may say that they want a female child. So you have to, this is the commonest second one. Wants a male child. One more. They want a male child. Please be careful. You may end up in jail. It is against the law. Promising a male child is against the law. You should know the laws of the land with regard to practice. Clinical practice. Right? What is the karma that is advised for getting a child of desired gender or rather sex? Pumsamana karma. Please avoid doing that. Many physicians have landed in a jail. Is it clear? So couple may ask for a male child. This last one is common. Female child, female partner with repeated abortion, congenital hereditary condition is very common. So these are the four commonest complaints or presentation with which infertility couple will come to you. So you have to ascertain what exactly they want. Besides this, there is one more. They are not able to consummate. I have seen couples married for 3 years, 5 years, 9 years, 11 years, never had even one encounter of a sexual intercourse. You have to make impossible possible through your advice. Okay? The sexual problem as a cause for infertility should also be evaluated or should also be elicited from the couple. Maybe they never consummated, that is the word consummation, right? Consummated, or the male partner may be having early ejaculation, or there may be total loss of erection. All these words may make you little uncomfortable, but certainly patients do come with you. I think I can talk on this with a lot of ease and comfort with all of you. I'm a happily married man with 2 children, but I don't shy away speaking about sexual matters with both the sons. I'm comfortable because educating them, especially the adolescent, will make them empowered. So besides non-consummation, premature ejaculation, loss of erection, there may be certain conditions because of neurological condition where the person will not be able to have erection. Spinal cord injuries, pelvic surgeries, where the male may not be able to have erection, so could not ejaculate. There may be something called as anejaculation. There may be something called as retrograde ejaculation, which is very common in type 1 diabetes. Please write down all this. You will not get all this information. I can promise you in the coming 10-15 years, there are very few speakers who would speak on Vajikaran. I am one among them. I can say. So type 1 diabetes mellitus, retrograde ejaculation is very common because of sphincteric incoordination, right? So these are the commonest, right? So in type 1 diabetes mellitus with retrograde ejaculation, the sperm will get into bladder because the external sphincter closes. Normally the external should open and the internal sphincter that is below bladder should close. Whereas in type 1 diabetes, the external sphincter will close and the semen will get into bladder. So postcoital urine has to be collected. After sexual intercourse, this urine sample has to be collected. The sperm has to be extracted and used for a ICSI, intracytoplasmic sperm injection. That is the latest. Next to test tube is a ICSI. Okay. So this is a ART, artificial reproductive technology. So these are the presentation. Next, let us get into history. AML is very important. Whosoever the infertility patient comes, active married life. For how many years they are married? Number 1. For how many years they are married? Since how many years they are sexually active? Since how many years they are intending to get a child? In this era of modernization, voluntary infertility, because they don't want to have a child, they just abstain, or they may abstain, brahmacharya. They may abstain from sexual activity, number 1, or they may use some contraceptives. They may use some contraceptives. So one is actively married life. As the actively married life increases, the chances of conception decreases. If it is more than 5 years to 10 years to 15 years, 17 years I have seen, the chances of conception decreases because the frequency of sexual intercourse decreases with increasing active married life. You have to ascertain, okay, I should speak about few words about your communication skill. When it comes to management or dealing with male infertility or rather male sexual problem, you need to be diligent. You have to use the word, you should be comfortable about using these words, not to utter a single word that creates misunderstanding. You should be impartial in your use of word. It should not be having any double meaning. You should be culturally sensitive. If at all a female physician, there should be a partner, husband should be there, right? Or rather, if you are counseling a male sexual patient, male sexual infertility, there should be a nurse or there should be a female partner or a wife with you in the consultation room. If you are consulting, you should be culturally sensitive. Developing a right language is very important. I have a experience of treating male infertility and sexual problem for last 25 years. I know how it is important it is to have a right language, correct language, scientifically simple words with correct, straight and correct meaning. Is developing that art of counseling is important rather than using culturally sensitive and use of right words is very important when you deal with the male infertility and especially male sexual problem. You should ask, the point I made about last 2 minutes is you should ask simple, straight questions, because the patient will be coming with specifically problem related to sex and the infertility. They are not able to get a child. If you shy away, you will not be getting correct information. Eliciting the correct information is crucial in the management of evaluation and management of male infertility. You should ask about frequency of coitus per week. Is there any sexual problem? Right, I have already told. Age of onset of puberty. Like menarche, in males, age of onset of puberty, whether there is delay, you should look into you should learn about knowledge about fertility period. Don't think, don't correlate. This is a universal truth. Correlate their general education with this, sexual knowledge. You can't correlate it. They may be highly educated, they may be least knowledgeable about sex and the sexuality and the art of love making. So you should don't presume anything. अब समझ में आ रहा है कि आप you should not presume anything. So you should ask these simple questions, whether they know about fertility period, whether they know all this information, whether the partners are cohabiting and sexually active. That point I should say. You will come across many patients where the husband may be in Gorakhpur, rather wife is in Gorakhpur and the husband may be in Ladakh. And the husband comes once in 6 months or a year. When they may get, they get to be with or together for 1 or 2 cycles. You can't label the condition as a infertility. So you have to ascertain, or there may be some non-sexual issues other than sexual issues or familial issues that may make the couple not to be together. They may be in the same room, but they may never touch each other. So cohabiting and sexually activeness is history is very important. Like any other clinical condition, any other disease, you have to note down all medical history. What is special about male infertility and male sexual is related to sex, right? And the fertility related issues. You have to note down, the couple typically will have a big file of files of related to IUI, intrauterine insemination. They will have the couples. The file may contain. You should review the file that may contain female menstrual history, ovulation study, everything. Then male, typically they will have semen analysis reports. Okay. Then Doppler study of scrotum and penis, serum FSH, serum LH, serum testosterone. These are the reports. So you have to review the reports very keenly. History of major and long-standing illnesses, pelvic operations. Hope all of you can understand, first year and second year, pelvic operations. Then medications, especially for gastritis, steroids. Then psychiatric drugs, chemotherapeutic agents, all chemotherapeutic agents. So they are having a negative effect on them. Road traffic accidents, especially over the back and the pelvic region. You should elicit, even I have the medication history, even I have seen patients who are taking neem powder, high dose of neem powder for management of madhumeha, diabetes mellitus, ending up in ejaculation. Totally, Tiktarasa Atisevan leads to Vata Prakopa, then an ejaculation. no ejaculate at all. Semen will not come out. Any other illness like Madhumeha, sexually transmitted diseases, psychiatric illness. Madhumeha is very, very important, especially when it comes to not from infertility perspective, but from sexual problem. Madhumeha, okay, diabetes mellitus type 2 and type 1 are important. Sexually transmitted diseases do affect the genital health. It leads to infection. Any kind of infection, especially genital infection, increases the oxidative stress. You just remember all these words. Oxidative stress, where the spermatogenesis or production of the sperm is hampered. Is there any history of addiction? Very, very important. Addiction, tobacco, alcohol, intravenous drug abuse. Especially alcohol is a gonadotoxic. It is toxic to testis. I'm a little worried whether I hope I am reaching these words. Are you able to understand? I'm trying to make, yes. If you don't get it, the whole effort, I have not slept yesterday night, so it will go in vain, waste. I don't want to happen. Especially when it comes to male infertility, history of alcohol should be elicited. Strongly, they should be advised to stop alcohol, number one. Tobacco especially affects the shape of the sperm. So, tobacco and alcohol, they are anti-ojas, ojohara. So, strongly, they should be advised to stop. History of mental illness, financial, social stress. Manasa karana, right? So, are there any strong, especially when it comes to infertility, stress can play a major role. Besides this, I need to tell history of fever, exposure to high temperature, history of a high-grade fever, typhoid, malaria, dengue in the last 6 months, because a bout of high-grade fever can reduce the sperm count drastically. I have done at least 6,000 plus semen analysis last 25 years. So, history of fever, infection should be elicited. Next, physical examination. When it comes to male infertility evaluation, please remember, you have to evaluate whether the male infertile patient is having normal secondary sexual characters. Hope all of you can get what secondary sexual characters. Whether their secondary sexual characters are properly grown or not, number one. What is the body type, whether male or female or unichoid, what is the body type, number two. Number three, penis, whether it is infantile or normally grown. Number four, testicular size really matters. Normal testicular size is between 12 to 20 ml. It is measured in terms of cc. It is measured with the help of goniometer, right? So you should elicit the testicular size. If at all, being a female physician, what you should do is ask for a Doppler study of a scrotum and penis, which is expensive, but you will get a correct information. Otherwise, a male physician can simply do bimanual examination of the scrotum and penis and can elicit the status of testis, epididymis, vas deferens. Then, very important is you have to ask for blood test. RBS is a must. If it is diabetes, fine. If not, ask for RBS, random blood glucose, mandatorily. Okay, so you have to rule out diabetes as such. When it comes to male infertility management, please remember FSH. There are two hormones. One is a serum FSH. Second is serum inhibin B. Please write down inhibin B. Besides these hormones, semen analysis makes an important aspect of a male infertility. You should know what is the, whether the person is normally a male by growth. There are two words. What is the difference between sex and gender? Can anyone of you tell me? What is the difference between sex and gender? Sex is something that is physical in nature, whereas gender is the orientation. You will come across people, I was filling up my son's PhD application for American universities. They ask you in the application, they ask you how you should be addressed. He, him, his, her, like, then they, them. So gender orientation is mostly psychological, behavioral. A male may feel as though they are females. So that is the difference between gender and sex, right? So when it comes to semen analysis is the most important besides testicular size, secondary sexual characters, testicular size, and the last one is semen analysis. Okay, besides that, serum FSH, serum inhibin, serum testosterone need not always be measured. If the secondary sexual characters are properly grown, serum testosterone, which is quite expensive, need not be done in every patient. But serum FSH will help you. Besides testicular size, serum, semen analysis, serum FSH and serum inhibin B will help you to differentiate between obstructive and non-obstructive azoospermia. Azoospermia is a condition where the semen does not contain sperm, or the extremely low number of sperms. Okay, just remember, I don't know how, by the time if you come across male infertility patients, you have to do all this. There's nothing more than that. I'm not overconfident, but I really mean it. Among the semen has got physical, microscopic, and biological parameters. Hope all of you can understand. Physical in terms of volume, color, liquefaction time, viscosity. Most important is sperm count. We'll go through the. I have given the PowerPoint. Please circulate it to all. Let them store it so that, right? Whenever it comes to, I know there are very few people who will guide you technically about these things. There are very handful people in Ayurveda who will guide you about all these things. So sperm count is the most one. Sperms do move around. Then they have a shape. They do agglutinate. Hope all of you understand what is agglutination. They may get clotted with each other. When mismatched, when blood group, with two different blood groups, they mixed, they become agglutinated. Similarly, the sperms get clotted with each other, maybe in hundreds to thousands to lakhs. That is called as agglutination. Semen do contain white blood cells, even it may contain pus, blood, etc. These are the characteristics of a Shukra. Appearance-wise, it is Shukla, Ghrita, Spatika, Kshaudra, not Kshudra, Kshaudra, which adds to translucent. Volume, Bahu, Bahala. Odor-wise, these are the Ayurvedic terminologies that are indicated for a normal seminal quality. Taste-wise, Madhura, because it contains fructose. Fructose gives energy. pH-wise, Avidahi. It is neither acidic nor alkaline. Consistency, it is Pichila in the initial stage. After 40 minutes, when it gets liquefied, it becomes a Drava and it flows. It is a Sara. Density-wise, Guru, Ghana, Sandra. That indicates the density of the, as per the density of the sperms, it may look a Guru. It has Garbhakara Phalavats. It has got a capability to fertilize the egg. They knew it very clearly. Then Anupravana Bhava. The sperm has got tendency to, rather semen has tendency to flow, at the same time sperms do flow. See, the natural selection is so beautiful that the sperm has to travel. When few crores are deposited in and around posterior fornix of the vagina, it has to cross the acidic barrier of vagina and pass through the cervical os, and the fertilization takes place at a ampulla, right? So all of you know physiology very well. So what I want to say is that Ayurvedic terminologies in the classic do indicate that the sperm has got anu and pravana bhava, right? The causes: genetic, dietary, lifestyle related, psychogenic, disease related, right? I am trying to make this simple for the first years. Most commonest, okay, I was telling about secondary sexual character, testicular size, serum FSH and inhibin B, semen analysis. One more is you have to rule out varicocele. Like most of you must have seen men and women, especially those who stand for a long time, having varicocele. Similarly, the varicocele do happen above testis. The pamphiniform plexus become a varicosed, leading to collection of the blood in the pamphiniform plex, leads to increased testicular temperature. Scrotal temperature increases, because of which, why testis, whether it is human or dog or every creature, male creature, it is placed outside, is to see that the temperature is 1 degree less than the body temperature, to facilitate a normal sperm production. So when the collection of the blood takes place, it leads to increased local temperature. So please rule out a varicocele. Remember, correcting varicocele will not correct a infertility. Okay? Because varicocele will recur after 1 or 2 years. Please tell the patient openly, because they will be spending 30 to 50,000 rupees for a varicocele operation. But it can be a solution. There are several genetic problems, whether it is Klinefelter syndrome, triple X syndrome, Kalman syndrome. There are several Down syndrome, right? Down syndrome, where male will not be producing sperm at all. They will not be having normal external genitalia at all. Especially you should remember about microdeletion of few of the genes on Y chromosome. Microdeletion of Y chromosome, please remember. Those who are extremely males with extremely low sperm, अब आदमी मतलब इतना सारे पेशेंट्स देखे हैं ना, आदमी का चेहरा देख के इसका स्पर्म काउंट क्या है वो बता सकते हैं. और especially, yes, I'm not overstating. चेहरा देख के बता सकते हैं कि ये मतलब टेस्टिकुलर साइज बहुत लो है, जिसमें टेस्टोस्टेरोन लेवल जो है काफी लो है. अल्प शुक्र लक्षण जो कहा है ना, अल्प शुक्र लक्षण. See, Shukra has got 2 functions: Dhairya, Chavana, and Preeti. Sushrita has beautifully explained. Dhairya, the aggressiveness in male is because of Shukra, is because of a modern correlation चाहते हैं ना हर किसी में, it is because of testosterone. The male musculature, the male bone structure, the aggressiveness is because of testosterone. It is because of Shukra. Preeti is love towards opposite sex. The design of testosterone is so beautiful. The design of estrogen is so beautiful. The world population has reached 800 crore. Yes. जो वाजीकरण है सिर्फ इसमें नहीं है. वाजीकरण इज वेरी एक्सटेंसिव. वाजीकरण जो है वो इट्स पार्ट ऑफ लाइफ. The love between male and female is something that goes in accordance with the structure. Amino acid जो sequence ऐसे बनाया भगवान ने. So the point I want to make is patients with extreme low sperm, if you ask for phenotyping and genotyping, right, you will get a microdeletion. Please do it with caution. You are going to label the patient. Extreme, these are excess of exposure to temperature, you should know. Those who work in foundries, kitchen, bakeries, those who work besides X-ray units, high vibration machines, they do end up in low sperm count and parameter. Thank you. 33. How much? How many minutes? Yeah? Yes, wonderful. I'll brush. Especially, I have seen patients from पूरे भारतवर्ष से नमक कहाँ से आता है? गुजरात में. गुजरात में कौन से गांव से? सौराष्ट्र में कौन से गांव से? कौन है गुजरात में यहां से? Tata has got their Tata and many other companies have their. I have seen, because I have done my PhD from there, I have seen tens of patients who harvest, and those who are from that area, Ksharapani, Kshara, Lavana, and Pipali are cause for infertility. And it do happen. Those who work in high temperature area, they do consume excess of Kshara, they do end up in a male infertility. Those who are exposed to Dushi Visha, pesticide, endosulfan, please remember, farmers will come, you should take a history. Excess of mental stress can usually leads to sexual problem, may also be a cause, indirect cause for a decreased, spermatogenesis. Many of the drugs have been labeled as a avrishya. Please keep we ask, are they used to any of the intake of any of these? I have already covered. Even you have to look for serum prolactin also. Males with the increased size of breast may be having a breast size and may be having breast milk. They may be having hyperprolactinemia. There is nothing to smile and laugh at. These are all signs. Everything is science, right? Testicular biopsy may be required. Testicular biopsy may be required to rule out the exact cause. There are 4 stages of spermatogenesis. So, to know exactly the cause, you may have to, especially to differentiate between, I'm not going to talk in detail, to differentiate between obstructive and non-obstructive zoospermia, you need to do testicular biopsy. Normal semen volume is 2 ml, color is grayish white, liquefaction time is 30 minutes, 60 minutes, pH is 7.2 to 8. Motility, rapid linear, slow linear, immotile, and non-progressive. There are 4 types of motility. Rapid linear and slow linear together should be 50%. All these are set by WHO, right? Sperm count 20, the latest says 14, it's meaningless. At least 40 million per ml is having very good fecundation or fertilizing potential. Sperm morphology, at least 30% should be. You can see the 90% of the reports, they will say that sperm morphology or shape is 90% the report says that 90% sperms are normal. No, only 30% of the sperms will be normal in a normal person. It may contain WBC1. These are the classification of a Shukradishti. There are 8 Shukradishti. How you can manage, how you can classify? You will be having all these details and you have to interpret it in terms of Ayurveda. Right? Vataja Shukradishti with these lakshanas, they correlate with oligozoospermia with low sperm count less than 20 million, teratozoospermia, that is sperm count, sperm shape, abnormal sperm shape more than 70%, zoospermia, semen doesn't contain sperm at all. So they can be clubbed under, classified under Vataja Shukradishti. Pittaja, typically pyozoospermia. When the WBC count or pus cell increases, which indicates infection, can be classified under Pittaja Shukradishti. Kaphaja Shukradishti can be asthenozoospermia. Asthenic personality, you know, where the motility is less than, say, 50%, asthenozoospermia. Kaphaja Shukradishti, right? Then Anya Dhatu, they may contain rakta, they may contain bleeding, they may contain debris, right? I've already told. So how you should approach? I'm having another 20 minutes before I get a chit. So how you should manage male infertility? It should help you improve the quality of sperm. Especially the focus should be on correcting the sperm count, motility, total abnormal forms. If these 3 improves, the chances of conception will improve. My learning from last 20 years is that I do target one parameter at a time with sperm count at last to enhance the overall fertilizing potential of the shukra, thereby increasing the chances of conception. Prescribing medicine is one, helping to beget a child is another. The sperm count may improve, the sperm parameters may improve, but when unless the conception improves, the conception happens, nothing can be done. So the drug which mainly act on Apana and Vanavata are desirable. First years can understand Apana and Vanavata should be desirable. So proper assessment of risk factors and prognosis is important. You should tell the patient to avoid alcohol, tobacco, intravenous drug abuse, any other medication. Stop exposure to hot environment. Avoid hot water exposure to genitalia, especially males. You should assess the prognosis. How far you can get the, it is a science. It's a science. So you should assess the prognosis, possibility of curing the condition carefully. In case of asadhya condition, advice for adoption may be done as a part of social service. Please remember, you cannot, wherever total azoospermia is there, where there is, the patient cannot go for artificial reproductive technology, maybe test tube baby or ICSI. Please remember, intracytoplasmic sperm injection. Because it costs 3 lakhs per sitting, where the patient can't afford. In such situation, you should advise the patient and you should direct the patient to competent authorities who do adoption. You are doing a social service. You are doing a social service, but it should be done through proper channel. Long duration and continuous medication is required. When you treat male infertility patient, tell the patient to take the medicine at least for 3 to 6 months before they switch over to other, because one cycle of sperm production takes at least 72 to 90 days time. So the aushadha must be cost effective, safe. Usually people, male infertility specialists, they थोक के बाप पे बहुत भारी महंगी दवाई जो है ना, गोल्ड प्रिपरेशन बेचते हैं, वो गलत है. By prescribing gold preparation, the condition will not get cured. Certainly remember that all gold preparation, whether it is Makaradwaja or Vasanta Kusumakara, whatever the gold preparation, they are having positive effect on the sperm parameters. Counseling and motivation of the patient is very important. You have to counsel the patient. Saumarasya Garbhakaranam Shrestha. Please go and read. Purusha Vajikara drugs to be used. Shukra Stambhaka drugs, when in case of premature ejaculation, Shukra Stambhaka drugs may also be useful. All right. Overall, the Vajikara drugs or Vrishya drugs do improve sexual parameter and quality of life and the weight of the patient. Please remember, I am telling you all these things in capsule. They are Brahmana, so they are going to increase the weight. So the drugs that are having Balya, Brahmana, Medhya Rasayana, Medhya Rasayana is also important. Every month is a test of patience for the female. इस महीना होगा क्या, अगले महीने होगा क्या? So you have to counsel the patient, male as well as female, and education about sexuality. Many of the patients you may have to educate. They will not be knowing where to insert and what to insert. Please don't think otherwise. That is the truth. That's why I said you have to elicit what is the level of their knowledge. Management of other diseases are very important. Pranayama and dhyana, relaxation techniques do help. I have seen patients benefiting. These are all theory. Let me tell one or two. I believe in these drugs. Ashwagandha, Mushali, Ashwagandha, I should tell. Ashwagandha, Kapikachu, Gokshura, Guduchi, Amalaki, Swarna preparation, right? There are 5 to 7 drugs which do really act effectively. Nutritional, okay. You must be, if you go through the second chapter, Chikitsa, Charak Chikitsa, Vajikarana Adhyaya is full of recipes which are denoted as Purusha and Vajikara. Remember that semen is rich with all essential and non-essential amino acids. Beginning from Masha till Mamsarasa, it's all amino acids. Protein, whether it is L-carnitin or there are many of the nutrients, it contains many micronutrients, trace elements, including gold. The semen do contain gold. The gold has been extracted from a semen in nano level. Please understand. So all the nutritional aspect will really help. Patients will ask whether they can take dry fruit. Certainly. There are many drugs. Panchakarma is essential. Remember, whosoever patient with male infertility comes, do one course of viration. If you That's quite amazing. No issue. थोड़ा सा नींद से जग गए बहुत सारे लोग. So Panchakarma is a must. Please do Virechana. What is the drug? Common drug that you can do is Panchatikta Gugulu Gruta, Sukumaram Grutam, or else Panchatikta Gugulu Gruta, Kalyanaka Gruta, or master drugs. Just do one Virechana, full course of Virechana, then you start a medication. There are several formulations. Basti do help. Just write down, Basti do help, especially Mustadi Raji Apana. For that, again, you can use PTG, Shirabala, Kalyanaka Gruta. There are few master drugs, right? Ashwagandha Gruta is there. There are several Grutas. So you can do a course of Basti. There are several drugs, Chavanprasha, Bhallatak Rasayana, Amlaki. I should say Bhallatak Rasayana, Bhallataka being Kafahara. Yes, Kafaja Shukadrushti, where increased viscosity, decreased motility do happen, do useful. Whereas Amalaki Rasayana being Balya and Jivaniya, it will be helpful in asthenozoospermia. Please remember, it's all simple. Shilajitu, Makaradvaja, Chandraprabhavati are useful in Vataja Shukradrushti. Right? Uttarabasti can be done with lot of care. Uttarabasti, I find it more useful in male sexual problem, but you are contaminating the normal bladder. So be careful. Uttarabasti should be done with lot of care. Despite all the care, contamination of the normal bladder do happen. In Pittaja Shukradrushti, if there is infection, typical Pitta line of management, Tribhuvana Kirti, Amrutarishta, then you can give Kaishwara Gugulu, very effective, Gandhaka Rasayana. If you suspect infection, you give them, right? So whatever the line of management comes from Ayurveda perspective, it's mostly like any other disease. At last, you can go for you can go for gold preparations. Chandraprabhavati do act wonderfully on Apana Kshetra, correcting the Apana Vata. You can start with as an initial Chandraprabhavati. Then you look into whether there is infection, Pitta line of management. After you correct it, then Vata. Then you can give a gold preparation. So all this you have to plan within 3 months. Especially you have to tell the patient to avoid, whether it is male sexual problem or male infertility, you have to tell the patient to avoid taking alcohol, tobacco, drugs, exposure to extreme rasa. Katu rasa, katu tiksta, ushna, vidahi, anna should be avoided. Next, let us come to male sexual disorder. These are the presentation. There are 3 or 4 presentation with male will approach. Loss of erection may be complete or partial, may be imminent or immediate or gradual, sudden or gradual. Loss of erection, of penile erection, that is sudden or gradual, right? Typically, patient may complain about early or premature ejaculation. They may come with Dhat syndrome, which is very typical about India. The modern physicians, andrologists, they do classify it as Dhat syndrome, where the male believes that they are losing sperm through urine. They pass sperm at the end of defecation. So they are losing weight. Their face is getting dark. They are not attractive towards females. They are losing memory power. They lose appetite. They become depressed. Even they may have the thought of committing suicide, loss of interest in studies, in work, in life. Typical of Dhat syndrome. बहुत सारे आपके आजू बाजू में देखेंगे तो बहुत सारे केसेस आपको दिखने को मिलेगा. It is very typical of males between 18 to 24. बहुत सारे मिलेंगे. Even they may think of committing suicide also. Please remember, it is least understood, improperly diagnosed. So it is a matter of concern. Yes. How many minutes? 10 minutes. Yes. Sexual misconcept, premarital counseling is very common. As I was telling, there may be total or partial loss of penile erection, loss of sexual. There are 4 components, children, remember, when it comes to male sexual or it's a female. First component is sexual desire. Second one is erection. Third one is ejaculation. Fourth one is orgasm. Fifth one is the overall satisfaction. These are the 5 domains of male sexuality, whether it is even females also, female sexuality, right? So you have to ascertain the complaint belong to whether there is loss of sexual desire, whether there is loss of erection, maybe partial, whether there is loss of ejaculation, no ejaculation, no orgasm. Anorgasmia is very common in females. Anorgasmia, no orgasm, is very common in females, whereas males also there may be loss of strength of orgasm, at the same time loss of oral satisfaction. Similarly, the point I want to make in 1 minute is that you have to ascertain about premarital, marital, extramarital relationship. Loss of loved ones, love failures. You may smile, but that's also one of the cause for a sexual problem. History of mental stress, any kind of stress, mental, financial, social, relational stress, do end up in a sexual problem. Here in this, duration of foreplay should be ascertained. When it comes to male sexual problem, duration of foreplay and their knowledge about the act of love making is very important. I have already dealt with this in detail. General education and education about sexuality is very important. I have already elaborated. It goes almost same. When it comes to chlamydia, or please don't mix up. I know all of you are young and just you have entered. Most of you are going to write, in your internship, you will write chlamydia / infertility. No, chlamydia is a impotence. Inability to have proper sexual, penile erection, right? The most commonest cause, especially in adults between 16 to 20, 16 to 30 is a psychogenic. So psychogenic. Never ever label, all of us, it is common to hear the sex is in the mind, right? But it is not so. In 50% of the cases, dear children, remember that the patient will have physical cause. You have to rule out physical cause for sexual problem. 50%, I would say 70%. After 25 years of clinical experience, I know that 70% of the cases, there will be physical cause for erection problem. So you have to elicit, you have to see that, you thoroughly investigate and label them as psychogenic, right? When it comes to management, Ayurveda do offer an excellent result. I have, in my clinical practice, with simple medications, beginning from ashwagandha, kapikachu, gokshura, guduchi, amalaki, medhya rasayanas, basti, whatever you do, simple, Mustadi Rajapana basti. One is, first is Vata Shodaka basti, Dashamuladi, Nirva basti, then Mustadi Rajapana basti. In certain instances, you may do Uttar basti also. You will get a wonderful, excellent result. So when it comes to premature ejaculation, is a very difficult condition to treat. Intravaginal latent time, IVLT, it is called as IVLT. Intravaginal latent time will be very low. There are 4 degrees. It is very difficult to treat. The female partner of a patient, male patient or husband suffering from premature ejaculation will cry, because they are deprived of the sexual pleasure that they were supposed to get. So treating premature ejaculation is a very difficult condition. It requires counseling, medhya rasayana, medication, shirodhara. Along with that, you have to tell them, you have to educate them to redefine their the way they will be doing a act of love making or sexual intercourse. It's a very difficult condition to treat. You can do virechana like in male, male infertility. I have given this, you can just go through this. Yes, the last point I want to make is you have to learn the art of counseling. If you have to treat male infertility and male sexual problem, you will have to have the right word, the right tone. I have not come across, because if you do not know how to handle, how to manage, how to speak, you may end up in problem. So you have to learn the art of counseling. You are a third party. No doubt you are trying to solve the most intimate and the most difficult problem on this earth, that is male sexual or marital problem. I have hundreds of stories to share about a male sexual problem, abnormal marital problems. So you need to, because this is a very potential area. Most of us believe, do think when it comes to sexual problem, it is in the mind, you give this tablet. No, it doesn't stop there. Whether it is infertility or males or sexual aspect, remember that it's not only Shukradhatu. It is beginning from okay. So you need to learn the art of counseling. So I'm a vivid learner of male infertility, management and male sexual problem. If you come across any rarer cases, especially I'm contacted by many of my students, especially management of azoospermia patients. You can't give false hope. You need to technically, or rather you need to evaluate the condition thoroughly, and you have to give an assessment. In case of obstructive, certainly it is a case of surgical management. Through microvascular surgery, the condition is to be managed. If at all there is normal sperm production, the condition should be managed through surgical management. Microvascular surgery is there. If at all it is non-surgical, you need to assess whether what is the size of the testis. The testis size is very so small, and there are very few number of seminiferous tubules. It's only through Vrisha and Vajikarana you should be able to get a few hundred good quality sperms which can be used for a intracytoplasmic sperm injection. So in what way you can help in azoospermia is through Shodhana followed by medication of at least 3 months. Yes, I need to tell the last point. In case of male infertility and male sexual problems, age of the female do really matter. In case of male infertility, in case of female age, if it is more than 30, the fertilizing potential will reduce. Whereas in case of male sexual problem, where the female has attained a menopause, the complaints or the condition becomes complex. So it is the male infertility and especially male sexual problem management is more of an art of medicine rather than simple prescription. So I thank Yogi Ji, Yogi Maharaj, then the Vice Chancellor, the Registrar, and the Principal, Dr. Manjunath, and all the faculty members. All are my great friends, and faculty members, for especially students, for attentive listening. I think my lecture was was of little use, and hope I could able to catch few 10 points so that it will be useful in your clinical practice. Thanks for the opportunity and wish you all the best, especially newcomers. A bright future. लगे रहिए, योगी जी महाराज जैसे आप भी कुछ कंट्रीब्यूट सोसाइटी के लिए कर पाएंगे, वो सब हमारे लिए, चाहे योगी जी महाराज हो या आचार्य बालकृष्ण हो या स्वामी रामदेव जो यहाँ मैं काम करता हूँ, वो सब योगी हैं, इसलिए उनका नाम युग युग तक बने रहेगी। धन्यवाद। इन टाइम, इन टाइम ना।
It was a very good deliberation by Dr. Girish, sir. He has beautifully narrated about the causes of male infertility and the management, especially the treatment aspects. When Shodhana is the important part of treatment, especially Panchakarma. Panchakarma is one of the broad line treatment which can be, which we can apply in many of the diseases, especially in case of infertility cases. That's most important. And followed by some of the special preparations like gold preparation, Russia, group of drugs are available. So he has beautifully acted because he's known for perfectionist. Because we happened to be colleagues in our previous institutes at SKM Hassan, and I know him very well about this, and he has been worked deeply in this field. So I thank the speaker for a beautiful deliberation. And
Thank you, sir. Thank you, sir. Now I will request Dr. Jayan Singh to facilitate our resource person, Dr. Girish.
आपका बहुत बहुत स्वागत। बहुत ही अच्छा आपने हम लोगों को चीजें बताई। आप बीच में आइए सब।
थैंक यू।
बहुत ही इंफॉर्मेटिव।
Thank you so much.
Thank you, sir. Now I request you, sir, to facilitate our chairperson, Dr. Naveen, sir. Co-chairperson, Dr. Sumi, sir.
Thank you, sir. I would now request to give away the certificate to the session coordinator, Dr. Abhijit. Thank you, sir. Thank you, Dr. Girish KJ, sir, for the wonderful presentation.
Thank you so much.
Thank one and all
Keep
present
blessing
here
us.
for the patient listening. Now the session is over.